friends, and thank you for tuning in to another episode of the Optimal Health Program. Hope you're doing well today. We're going to cover a lot of great information, as you know. Hopefully everybody had a wonderful weekend, a little bit of a long weekend, holiday weekend. We're hearing from a lot of people that have had a lot of fun, and some people had some running around to do. Frankie, did you want to give us a little bit of an opening story on that?
Doc, I'd be honored. So this was the morning of 4th of July, right? Friday. I'm in Montauk with my beautiful wife, and we're up early because we hear the beautiful sound of oceans crashing and waves crashing, and we're looking out. We have our little dog, Louie, with us. And sure enough, we're looking out, and my wife says, "Is that a dog?" And I look down, and there is a husky coming out of the muck, out of the shrubs where the deer run. I'm like, what? And this is, mind you, on the edge of a cliff. So this is like a 50-foot cliff. There's a staircase to get down to the beach, but it's not, these stairs every couple of years, they kind of fall apart. They got to be rebuilt because of the currents. Mm-hmm. So there's no stairs right now. I'm like, how is this dog in my yard? And it starts running around, sprinting. It goes into the house. My little dog, we're trying to hide the dog. And he's like, he's like, am I being replaced? What is going on, Louie? And this was probably a 45-minute to an hour affair.
Oh, my gosh. It's a party-crashing dog.
Oh, yeah. And this guy, he runs in the pool. He's part of the family.
Wow.
And I'm just I just say, hey, come on, little boy. Like, I don't know what to say. He has a collar, but no tag. I don't know what the name is. So it ended up being a girl. We found its owner. Roxy. So shout out to Roxy in Montauk. And quite the adventure she went on.
Oh, my God. Roxy's Montauk Adventure.
Yeah.
That could be a children's book.
I'm going to write that one down.
Too funny.
So that was my morning.
That happens, I think, more than people realize, because dogs every now and then love to just get out and run around and explore. The first German Shepherd I had, Maximus, loved that. And at one point, I couldn't figure out how he was getting out because I have a big, black metal, like a hurricane fence around, the pool in the backyard. And all of a sudden, I see him sitting in the sun on the driveway. I'm like, how the heck did you get out? Until at one point, I went in the house and I watched him. He went behind the pool, and there was a propane tank that we used for the heater. He would jump up on the propane tank, which was obviously higher, and just jumped over the fence. So that was his little sneaky way of escaping. And sometimes the police would call and say, "Oh, Mrs. Jones said there's a werewolf on her property." And I'm like, oh, not again. He would go to a famous musician's house that lives across the street from me to the right, someone who we all know as the Pianoman. And, he would just go there and hang out and just lay in his yard. And again, someone would call, and it was just, this is embarrassing. But, that's what dogs tend to do.
And someone's writing in the chat, the ticks. That was the thing. I wanted so badly. It was such cute. I love huskies, beautiful blue eyes. And I just want to grab this dog, but I will not touch. It had long hair.
Oh, yeah.
And I'm like, no way.
That's the magnet. You say the bush is there where the deer and the spirochetes play.
Yeah.
It's not the deer and the antelope anymore. It's the deer and the spirochetes.
Right. And I'm, he's trying to jump up, give me a kiss. And I'm like, it looked like I was Captain Jack Sparrow, like running away. I don't have shoes on,
Ay. The things we have to worry about now as time passes in this crazy time in society. Okay, so for people who'd like to chat, every now and then we get a call, 1-888-420-9272. Otherwise, Instagram and YouTube and Spotify and all the wonderful channels that we're on, Rumble, of course. We'd love to hear from everybody and take your questions as we've done. Doing this question and answer thing for so long is great. I love it. We're also going to plan probably a Saturday afternoon lecture at the Marriott Hotel within the next month or two. Try to see when we can do that. Saturday afternoon seems to be the easiest time for people to come because they don't have to go to work during the day and come home and run in the evening. That's what we used to do it. But we'll try to do it on a Saturday afternoon. We actually do the podcast from that spot. So I think it'll be fun. And we'll have different people join us and chat. So I'm going to try to see if I can put together a couple of cool people to talk about different things. So We'll set that up. If you're interested, always,
Yeah,
give us a call.
someone's
text.
asking which Marriott. This is
The one in Uniondale. It's not far from my Garden City office. Either that or the Garden City Hotel. Garden City Hotel might be a little bit too much.
I'm with you.
But we're definitely working on that to set that up. All righty. Anybody out there yet, Frank?
People are just discussing our dogs. My debacle.
It's a dog's world.
It's a dog's world. And yeah, people are asking if I use the duct tape. I believe they're referring to the tick process we were talking about.
Yeah.
I personally did not, but I was wearing white pants, and I
didn't know that you have to run after a dog racing around and jumping in your pool.
Right, but I did. I never wear white socks. I did this trip, and it was only for ticks.
Smart.
Yeah.
Smart.
So I'm listening.
Think about it. Looking a little bit funny and wearing the socks under your clothes and the tape there, who's going to know, number one? Number two, if you find ticks on your socks, you should be happy.
True.
Because you're preventing them from crawling all the way up and going somewhere that you might not even be able to look at and find. So imagine having to ask your partner, hey, can you check me for ticks? And having to bend over.
Someone said, I didn't have any ticks this weekend, but I did get hit by a bottle rocket.
Well, close. Bottle rocket would do far less damage.
As long as all your fingers are there.
Exactly. Too funny. Let's go to some of the questions that people have sent in through the email to the office.
Oh, we do have a question real quick.
Yes.
Someone's just asking, what are your thoughts on sunscreen? Do you think it's dangerous? I've been trying to go straight for zinc, but I look
They've been
like
saying
a
that for a
snowman.
while now, that the chemicals in sunscreen are dangerous, maybe more to some people than others. I think people should try to use things that are as natural as possible. Now, there's a card store not far from where I live, and they have this really cool sun lotion that has all natural things in it, coconut oil and Brazil nut or something else. It's a dark-looking lotion, and you can't burn if you use it, and people tend to tan really well with it. I'm going to have to look to find the name. I think it's Maui Babe or something like that, but I've seen it in a bunch of different places. Let me just make sure that I'm saying the right name. Because there's no... Oh, Maui Babe Browning Lotion. Yeah, that's it.
There we go.
Maui Babe Tanning Lotion, Browning Lotion. It's all natural substances. What kind of nut? Kaluki nut? Cuckoo nut? Cuckoo nut?
I'll take any nut.
Antioxidants, vitamin E, C, coffee plant extract, aloe. Very nice things. A little bit of potassium. But very nice things in it. I've seen it. I've used it for years, and there's none of those chemicals that are thought of to be risky or dangerous.
Someone said I've heard the sprays are what to stay away from.
I imagine so, but do a little research. A lot of this information you can find out now. Lots of stuff is coming out, and thanks to RFK Jr., et cetera, about the dyes. They're taking dyes out. Apparently, they're taking the mercury, and they're going to take aluminum out of vaccines.
Wow.
So, a lot of great things to look forward to. I follow him on Instagram and such and TikTok, and I think he's a godsend. So, people should follow. Dr. Malone, I follow. You learn and look and listen. Follow, because you're getting really, really good information.
RFK to the moon. Also, I did see something. He's getting rid of pharmaceutical commercials.
That'd be great.
Or at the very least, they're making sure that they're not it's not just two people dancing into a field with no explanation of what it actually
commercials
does.
have always been there to try to market something that people wouldn't necessarily want to buy. And look for how many years were there ads and marketing in magazines and everywhere for cigarettes. And then, I don't know what year it was, they banned all cigarette commercials from TV, which is a wonderful thing. It never should have been there in the first place. But the power of the dollar, marketing companies, et cetera, and big companies were paying a lot to allow these things to occur. And now that's changing. So this is really, really important. You don't want kids smoking. And that's why they took all the ads out of baseball fields, because they were putting ads everywhere to try and get people as young as they could to smoke. Kids shouldn't be eating the food with all the dyes in it, the dangerous dyes. So that should be taken out of foods. We know that that's underway now. So we're trying to get back to a healthy diet and healthy lifestyle. It's important.
Yeah.
What's more important?
Yeah, and Alex in the chat just saying, I always thought that the food pyramid was upside down. I'm very glad that it's restoring to what it needs to be.
I mean, information on eating the majority of foods in your diet to be carbohydrates and all that sugar has caused nothing but problems. If we can rationally look at other countries that don't have tons of sugar and carb and junk food and blah, 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 they're much healthier. They have lots of vegetables, and they have really good organic, healthy protein sources. Now that people here are getting smart and they're going towards good, healthy protein sources, organic things, and getting away from the chemicals, the foods, and the grains and the GMO, people are doing really well. And I've seen this in my practice for years now. So we have to continue to follow the idea of the Mediterranean-type diet and keep the bad stuff out and the good stuff in.
And we got Stork Deliveries in the chat saying they glamorize smoking in the old movies. I'd argue they're still glamorizing smoking in the movies.
So a curious thing, years ago, a doctor that I knew, I learned a great deal from, he was one of the doctors at the hospital I did my internship at, and we got along so well that he was the medical director, and I became sort of a liaison to the interns and residents. And in his office, to make a point, he had these little pictures, framed pictures of ads of doctors suggesting that people smoke because it would calm them down and soothe their throat. Now, these ads had to be back in the 40s and the 50s, but they would hang in doctors' offices and they were all over the place. You could look it up online. I'm sure you could buy reprints of these things, but that's what they had, before we were allowed to know that they created and caused problems. So there's a lot of things that went on early on that were bad that we weren't educated about.
Just so ridiculous. Do you really need a study to know that if your throat's not feeling too good, maybe smoking a cigarette's maybe going to make it feel even worse? Just hilarious. Someone said no GMO foods in other countries.
It's true.
True.
I like the fact that Italy has kept all the GMOs out, refused to have this lab-grown, freaky, whatever meat. I don't know what it is.
Beyond one of those, or you're talking
No, there's
about?
Beyond, which is made as a, quote, vegetarian type option that's supposed to look and taste like meat, but they're growing stuff to make lab-grown meat, like genetic.
Yeah.
I don't understand the process.
I don't want to.
I think, and of course, who's behind it.
Bill Gates?
Big Billy. And I think that stuff should be disallowed everywhere. But, people are getting more intelligent. And I think if lawyers, because they're the ones who could bring big class action suits, will get behind all this stuff, it'll keep them busy. They'll do the right thing. And people have to get support to fight against these things. So I think it's happening. The food revolution, the health revolution is happening.
Right. Someone saying in the chat, my childhood doctor always had a cigarette in his hand while I was in his office. He used to blow cigarette smoke right in my face.
My God. That's horrible. You can't imagine that doctor lived a terribly long life. There's a lot of evidence that parents who smoke, the kids exposed to secondhand smoke, all have asthma. I mean, bronchitis, the information's there, literature's there.
Yeah. Someone just asking, what the heck is actually in lab-grown meat? Is it just muscle cells or are there chemicals?
I'm sure there are chemicals because you can't get away with doing anything without putting chemicals in it these days. So I think they're taking muscle cells and they're growing and extracting and doing something completely ungodly to the meat to try to sell some new product to make you think that it's healthy. Companies that do this stuff will put bad things into it, and you could extrapolate this out to other things like injectables, and they'll make something bad. Oh, yeah, this is really good. It's going to help you. It's going to prevent it. It's going to do it. Meanwhile, it doesn't. All it does is give you problems.
Yeah, someone's saying, I couldn't even imagine what this will do to your gut bacteria compared to regular meat. I mean, you want to be a test dummy? Ugh.
I don't know. People just have to be a little smarter, and people are becoming smart because they're seeing and hearing from people who have knowledge. And, an article came out about the CDC, and everybody's seen this. 1,153% is the number. Okay, everyone's seen this, so I can't be bringing something new to the population. The hepatitis vaccine at birth, 1,153% increase in the risk of autism. CDC, they published that. So think about that. And think more and more about that. So.
Someone's asking, do you do an OAT test, organic acids test?
It could be done. Most insurance companies don't cover it. It gives us some information. The first thing we try to do is do things that insurance typically covers, which is our big blood test. We look at CBC, chemistry, a full vitamin panel, absorption, digestion, immune response. We could look at a full thyroid panel, 12 different things, where most doctors do 2 things. We could test and screen for allergy to foods or inhalants. We look at heavy metals, a wide range of things that other doctors never do. There are some tests that aren't covered. The methylation test, looking to see if you can convert regular B12 into methyl B12. Methylation's an important process. That's typically not covered, but that could be done. There are tests for Lyme disease that are super important that go beyond the basic tests the labs do. Some insurance companies cover that, like Medicare, yet others don't. So, you have to weigh how much good information are you going to get from a test where the patient's got to pay a good amount of money for it. A while back when we were doing genetic testing, 2018 and a little bit before then, every lab wanted to do it. Every doctor wanted to do it because there were great studies and good information to come out of those tests. So one test would tell you genetically if you have a risk for cancer because someone else in your family had that kind of cancer. Great test, brilliant idea. And another test would show you how your body breaks down medications. And if you were unable to break down a medication, if it would harm you, you would know. If you were unable to break down a medication and it wouldn't work, you would know, or if a medication would work. And then which medications you can't take at the same time because there's obviously a interaction that's bad for you. But those are expensive tests, and I think the companies doing them were billing the insurance like $6,000, $7,000. And then the insurance company stopped paying for it because they didn't want to have to pay for all these things. People stopped doing them. And I don't see a real reason why a person would have to spend that kind of money on doing genetic testing. So we have to weigh that. And I tell patients, yeah, you can do these tests, but remember it's these unusual tests are going to come out of pocket.
He says thank you.
You're welcome.
Still, we got a couple more lab meets.
Yeah, I don't.
How do we make sure people are just thinking that there's going to be a time when restaurants don't even tell you that it's fake meat. That's all. I have some trust in RFK that maybe we're going to have, the same way as you buy some cigarettes, there'll be a warning label.
So there's a term called full disclosure. When a doctor does a procedure on you, he's got to give you full disclosure on every possible risk, alternatives, benefits, side effects, whatever. Every surgeon who's ever lived has had to do that. It's done for everything, but unfortunately, it's not done for other things in medicine. And you could easily understand what I'm describing. There has to be, in a similar fashion, if you're not using, what's expected, regular meat, and there's some sort of other substitute, that people have to be told. There has to be a standard. There was a great TV program. I forget what channel it was on, who the investigative reporter was, but it was a great evaluation. They went around to like 20 restaurants, and the restaurants were charging a lot of money for bronzino, which is a really delicious Mediterranean fish. But when people that were the investigators, went in undercover and were ordering the fish, and they took some of it home, and they had it tested, it wasn't bronzino. there were other really cheaper fish that were used, but sold as Bronzino. And when the restaurant was confronted, they didn't want to hear any of that. But this is the sort of thing that goes on. I think it's been going on for years with certain types of fish. Is it a scallop? Is it a skate wing? You know, like a big skate, and they're punching out circles of meat that look like scallop. I mean, I think that's been going on for a while, but people have to really be aware and ask, you know?
I'm seeing someone talking about, and I've actually heard this too, the calamari, or galamad if you're Italian.
Calamari.
People are saying there are, some people swap them out with pig rectum, cut up, and they serve it as calamari. It's actually.
Is that
I have seen that.
true?
It is.
We'll have to look that up online.
I'm Googling it right now. Hold on.
That would be bad.
It was one of those things like my brother told me. And I'm like,
I mean,
okay,
you'd like to
yes.
think that it was a little bit of a hoax, but who knows? You know, who knows? Yeah.
Looks like it could be it could be a hoax, guys.
Could be
could
good
be.
if it was a hoax.
Yes. According to Google AI. As long as,
Okay.
we're good.
Had me reeling there for a minute. I like calamari. I don't like it really fried or battered or stuff on it. I like it grilled. Just clean it and grill it. You know, a
I
little
don't
bit of
mind a little
lemon.
fry.
Nice and tasty.
Someone's just talking about how they moved to Beyond Meat and it just destroyed them. They felt like crap. They never went back.
Yeah, so there are other things that are in it that you may not want to eat or be exposed to, you know? It's entirely possible. I think natural food has always been the best thing to have. And healthy, natural, organic food is what you should have. No preservatives, chemicals, colors, dyes. You can look up a documentary on meat glue, which may sound weird, but they take bad scraps of leftover different things and they kind of grind them, put them together, and they use a meat glue to make it stick together as if it's a muscle or a piece of steak. But look that up. That's what some companies are doing.
Yeah. Someone just said you couldn't imagine how high the levels of sodium are in Beyond Meat, which
Really?
I've heard that.
Must be, because they use salt and fat and sugar to get people to like the taste of something, so they sell more product. They get addicted to it. That's just the way those foods work.
In 2024, Beyond Meat reported a net loss of $44 million. So I don't think it's catching on as they wanted it to.
Good. They shouldn't be around too soon. Let's go over some cool articles.
Oh yeah, tell us about the cheese, Doc, because you freaked me out this morning.
The cheese. Okay, so this is a catchy title for this article. This comes from one of the medical journals that I took a look at this morning. Cheese may actually give you nightmares. Here's why. So researchers say that 56% of people in the United States and 31% in Western Europe have a sleep disorder. Studies show a variety of different combinations, causes stress, anxiety, hormone decline, blah, 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 too much caffeine, etc. But too much dairy, especially for those who might be lactose intolerant or milk allergic, may cause nightmare and sleep disturbances. Doesn't sound crazy to me, because I have a lot of patients that have food allergies that are delayed. They don't realize it. When they're eating the food, they don't get swollen lips or obvious symptoms, and so they would continue eating it. But it's curious to see in studies done. One doctor published some info in the Journal of Frontiers of Psychology talking about the dairy correlating with allergy and lactose intolerance causing nightmares and sleep disturbance. So I can tell you that the majority of people that I see, that once we find out through blood test and then secondarily through skin test, have an allergy to a food, you take that food out, and routinely we see people say bloating, indigestion went away, headaches went away, they're sleeping better, their skin's clearing up. So you can see a variety of things happen when you pull an irritant out of your diet. So Absolutely makes sense.
Someone in the chat saying, I have been saying for years to my wife that when I eat blue cheese, I get the most intense dreams. You are affirming me, Doc.
Yeah, absolutely. Now, not that you don't want to have a little blue cheese now and then.
I love blue cheese.
Yeah. Or have it a little bit earlier in the day so that it may not provoke the dreams. But yeah, you have to listen to patients because they'll tell you exactly what's happening. They may not understand it, and it may not make sense to you initially, but to be an open-minded doctor is an important thing. So once you present your information and we look to see what's contributing to that, we find this all the time. Here's another interesting study, comment about instant coffee. Does anybody really drink instant coffee anymore? The other day I saw something online which was funny. Sebastian Maniscalco, funny comedian. And he was talking about the difference between years ago and today. Years ago, someone would ring the doorbell. I remember this clearly when I was a kid. We all ran to the door. We're like, oh my God, someone's here. It's company, Made a big thing about it. Mom would get the coffee urn and get the big coffee urn going or have a bundt cake or something.
And now.
And you had a big thing and blah, blah, blah. You didn't really answer the phone because you had company. It was so important. Now people ring the doorbell. You close the lights. You turn off the lights. Everybody runs to hide. And, who is that? Who could possibly want to come over at this day or time of night?
Call the cops.
His version of the coffee part was Sanka because there's this powdered coffee that came in a jar. You kind of either put that into hot water or however you did it. And the Sanka was the instant coffee that, people had back then. And I really remember going to my friends' houses, and I must have been 10, 12, 15, up until maybe the 20s or so. And there'd always be a piece of cake, and there'd always be coffee. So it was the thing for anybody that would come over was cake and coffee.
Yeah, people in the chat are like, wow, you're bringing me back.
Oh,
We
yeah.
talked about instant coffee in a minute.
Yeah, that's why I think Sebastian's so funny is he brings back things that everybody relates to from the past. Very interesting. So this discussion about instant coffee affecting your vision, they talk about 200 million people have macular degeneration, which is the breakdown of the retina. And the macula is where the beams of light, when they hit your cornea, hit your lens, and get focused to the specific spot in the back of your eye, that's the macula. When the cells start to degenerate and break down, you have a loss in sharpness and focus of vision. So they say it occurs for a variety of reasons. Macula genetics, damage to the eye. I think heavy metal exposure correlates with it. But they say drinking instant coffee may have some sort of connection. So food science and nutrition research, Dr. Liu was the one who looked at this, talking about when they looked at different people and what they had in their diet, those that had the instant coffee compared to regular coffee had a higher incidence of macular degeneration. They looked at different groups, decaffeinated, regular coffee, instant coffee consumption, and I didn't think instant coffee was a big thing. So it may very well increase your risk for age-related macular degeneration.
Someone said, well, we got cake and Sanka, the good old days. But then someone's just asking, with the cellular, with the macular degeneration, is that something that stem cell could help?
Absolutely. We have a great video online. A lovely lady who had significant vision loss, very cloudy, almost like a tunnel type of vision. And she was unable to write and see what she was doing. We did the stem, IV, and then nasal. We drip it into the nostril so it hits the back of the nasal cavity while you're lying down. And she had significant improvement over the course of about a month or so. And she was able to see more clearly, color vision improved, and she was able to write, which she was able to write her checks, pay her bills and write letters to people. So you can see her talk about that. So macula definitely can be improved by getting your own cells to create repair. And that's what stem cell does.
Maybe we can get that on Friday's show.
Yeah, we're putting together, and what Frankie and I are doing are putting videos together, so comments of different disorders, and then putting a couple of minutes worth of video from a patient who has that disorder or something similar to be able to show the result.
We got someone just saying, my dad's dealing with vision loss from macular degeneration. They say they're going to reach out. All right, here. We got the website on.
Certainly go to the website, look at the videos, drcalapai.com. And you can call the office, 516-794-0404. We'd love to help you out. Thank you so much for your emails to our website. We're getting so many of them. We have 3 people now, 4 people going to be. So I have 3 or 4 people coming to the office, reception staff, and even PA sometimes. And they'll ask me the question. I say, okay, tell them this. This is important, that's important. So we're giving you the answer. I can't directly type. I'm horrible at typing. So it's typically better we give you a little bit of an overview, answer you, and then people come in for the consult or telehealth consult, and we go more in depth into it, get your blood work done, whether we have you come in do the blood work in the office or have the lab go to your house to draw your blood, as we do with some of the patients that we're doing with the RPM. We can get it all done.
We got my friend got his stem cell treatment from you last week. He's very happy.
Wonderful.
He came in to treat his diabetes.
Wonderful. I remember, yeah. Very cool, gentlemen. It's from a doctor's standpoint, it's so great to see patients who read, learn, want to know more, are interested in all these things, because it just becomes a great connection, a great back and forth of information and questions. And I love questions, and I love to explain even how some of the simplest of things work. And when I sit there with the patient, they had that look on their face like, yeah, give me some info. Let's go. I'm excited about it. To coin a phrase from the population, let's go.
Let's go.
It's rewarding to me because I know they're interested, and I know they're going to do the exercise and the diet. I know they're going to get their results. So I feel bad for other doctors that don't have that engagement, that don't have that sort of excitement, with patients. But this is one of the things that I love the most, Yeah, look at the videos on the website for everybody. Look at Alzheimer's patient, MS, Parkinson's, a few stroke videos, reversal of diabetes, COPD, macular degeneration. The list goes on, hips and joints and all of that. And we have a few more to put up on there, which we will over time. And, we love the fact to show how people get the best results by the comprehensive approach, correcting vitamins, minerals, hormones. As I mentioned, we use vitamin packs now that are specified to your requirements based on your blood tests and your condition, and the stem, who works unbelievably well.
Doc, how do you know when it's time to stop driving if you're losing your vision? When it's late at night, I can't see anything with these streaky lights.
It may be time. I talk to people about this, and look, when you learn to drive, you have your autonomy, you can get out and go. It's a wonderful thing, psychologically a wonderful thing, for your whole life. But when your vision is challenged and you either have issues with blurriness or fogginess or streaking, or, you're taking a risk for yourself and for other people. So I don't know what your vision is like during the day. Your eye doctor really should be able to tell you, and you should be honest, and your family should be honest and tell you if you're doing okay during the day to drive, even short distances. That may be safe enough. But if your reaction time isn't good, or if you're not seeing well at night, I wouldn't do it. Because God forbid someone's coming along, you don't see them, and you hit them and you kill somebody, then you have to live with that, which is extremely difficult to live with. So you've got to be able to sort of break it down. And the people who you're in the car with, I'm sure you love those people. You got to have a talk with them, and I wouldn't drive at night at all. If you want to remain driving short distances as I used to say to my parents, drive to the deli, which was a block away, which when I was a kid, I really didn't need to drive to. When I got my license, I wanted to drive to the deli, rather than walk, because you do. But I think you have to have a conversation with your family, your eye doctor, and see how you could modify that. Why take the risk?
And then a follow-up, I was told I might need eye injections for wet macular degeneration. How effective are they? And
So there are a lot of people that do the eye injections, Lucentis, or a couple of them, and some people will stabilize the degeneration to some extent. And you could look for literature on that on Google Scholar. I just think doing an injection is not repairing the damage or the loss of cells to the retina. That's why I like stem cell therapy, because you're putting your own cells to the area to create brand new cells, to create repair. So I think that's a great option. For those people who want to do the injection, if they say that they're getting result with it, that would be fine. It's just I would like to see more of a result by changing the cause of the problem, as opposed to just using a med per se to temporarily change the symptom.
someone's got a suggestion. They said use rose-colored sunglasses for driving at night. It cuts the glare down from the headlights. You can see everything.
There are a variety of glasses made from many different companies that are glare, blocking glasses. I bought a pair. Makes me look like somebody that's walking on the moon. If we actually walked on the moon.
That could be its own.
Yeah. Pretty cool if you look at back and forth. There are interesting comments on both sides, but they're big, orange, shiny orange glasses. But I'm telling you, there's just no glare at all that gets to your eye. Because, you look funny, like a grasshopper or something, and you're a praying mantis. You look around and you can see things clearly without having to squint and have that difficulty. But there are other good glasses I have too, made by Ray-Ban and Oakley and Maui Jim, that are cool sunglasses that block the glare. But yeah, you got to block the glare. But then some of the sunglasses, it's just too dark. You couldn't use them at night.
Okay, a decent amount of our chat's been using these for quite a while. All right, there we go. I got the. I'm so used to wearing glasses. I have contacts in today, but I have the green. I got the blue light. All right, I'm staring at screens all day. I'm blocking. Yeah. I'm doing what I can.
Yeah. Okay, we have a email from the website. I've had fatigue after I got the flu last year. It seems to be persistent. 43-year-old gentleman. Well, it happens a lot, more than people think, more than people would know. But if a bug, a virus, comes along and makes you feel lousy and your body can't kill it, that virus can linger almost as long as it wants. There are viruses that are extremely common, Epstein-Barr virus, cytomegalovirus, and when they come on board, if your immune system is not strong enough, then the bug is going to live there and stay there. Epstein-Barr, has a protein called LMP1, which helps to inhibit your immune system from knocking it out. Great research on that. And I show people a little handout that I did on Epstein-Barr a few years ago. But it's not a good bug. And overwhelmingly, if you look at people that have lingering viral or other infections, it's because their immune system is affected. Now, why may that be? Maybe their vitamins are low. If their vitamins are low, why are their vitamins low? They're not taking them or they're not absorbing well. So we have to kind of look at all the components of why a person is tired specific to flu or viral infection. There's a great deal of research on intravenous vitamin C, help to inhibiting flu, even Epstein-Barr virus. They use it against cancer all the time. It's very common. So if you look at Google Scholar and you put into the search box intravenous vitamin C therapy, there's 1,500,000, 600,000 studies talking about vitamin C effect against all of these things. So I think that makes the most sense. So most of our patients do really well with that. However, I wouldn't just look at a person and say, yeah, just do this. We want to take a look at their blood work, make sure your thyroid's good. If it's not, we'll fix your thyroid. If testosterone's low, we fix that. If your vitamins are low, we fix that. So it depends upon what you present with. It's never a one cause, one treatment thing. We have to learn about the entire picture.
We have a comment. Someone's just thanking you, Doc, because they started putting Neosporin on the inside of their nose, and they've cut down on cut down on their allergies.
Good.
Love that.
A lot of things come into your body that way. Most creatures do. So if we can prevent them or get them stuck there and can blow things out, I think it's a great idea. Some people get dryness in their nose when they sleep at night, and they'll put some, and it used to be people used to put Vaseline in there, but in a similar consistency, the Neosporin is probably better than the Vaseline because it has some antibacterial effect. And there are doctors I knew years ago, and this is pretty cool. This is a blast from the past. When I first got into medical school, a girl that I dated went to a doctor who was in Merrick, an old-time doctor. Good-sized belly, suspenders, bow tie, cool. I'm pretty sure he was a DO. But he would culture the nose routinely for people that had any symptoms that were nasal, sinus, or otherwise. He'd culture your throat, even culture the ear. I mean, wherever he thought there was a bug, he would culture it. And he would take that culture, swab it on an agar plate, a little plastic dish that had agar there, and that would grow. And it had sugar and gelatin, and it could grow the infection. So they'd incubate that in a little device, looked like a mini toaster oven, and at a certain temperature, these creatures would grow. Then you would look at that and try to define what bug that was by comparing it to pictures of the bug in petri dishes from medical textbooks and make a diagnosis. This was brilliance back in the day, which is not done anymore. Then they would take these tiny circular antibiotic discs, almost the size of the top of an eraser on a pencil, very small. It's probably, 4 millimeters, 5 millimeters, and drop it on different parts of that infection and see the biggest zone of inhibition. When you drop that antibiotic disc on there, how much killing effect would occur, which means the bug would be killed and you'd have a nice clear zone with no bug around that disc. And based upon that, they knew what antibiotic to use to help to kill that bug. So it was a pretty smart idea. And back in the day, I guess in the 90s, that doctor would take some of that mixture, sterilize it, and then give you a shot of dead particles of that bug to make your immune system go crazy to kill that bug. And those people wouldn't get those infections again because now their immune system was primed to kill that bug. Genius.
Genius.
Yep.
What?
Genius. I remember it vividly.
When was that?
In the 90s.
That's insane.
Had to be when I first got out of medical school in 86.
Oh, this...
Very curious.
You got them going, Doc. Stanley Kubrick said he filmed the moon landing in his movie studio, right where they filmed 2001: Space Odyssey.
Yeah, I wouldn't argue with that because I've seen some things that are interesting. The bottom of Armstrong's boot and his whole outfit is in the
I just saw
National
that.
Archives. And then it's a flat bottom sole, and then there's lines on the sole on the imprint of the moon. When you watch that module leave the moon, it doesn't even look like a firecracker allowed it to separate.
It's ridiculous.
And you have this gorgeous view with an elevated, camera watching this thing go up in the air, but no thrust, no rockets. I mean, it begs the question.
Come on.
And then you also have Buzz Aldrin at various interviews talking about we never went. It wasn't unsafe. It wasn't dangerous. There's so much that goes back and forth. I leave it to you, the public, to decide. And I question lots of things. I question everything.
Yeah, the chat's already saying, look at the shadows. Give me a break.
Exactly. Shadows, the flag. I mean, there are so many things that just don't make sense. Also, it was 69 when that happened? So how is the technology so good that the president, who was it, Nixon, picked up the phone and talked to the astronauts in moments?
With no delay.
No delay, clear sound, clear everything. How is that possible? And I use my cell phone all the time, And my friend Mike called me yesterday twice. He said, your phone's not ringing. I said, what do you mean? I called you. And I looked, and there was a message, but the phone never rang, and it wasn't in my list of calls. Phones are not good today. How are they great back then? I don't get it.
And just a funny sidebar. I told you my mother turned 60 a couple weeks ago. We had her nice party at a nice restaurant, and we're all leaving. Most people had left already, and I noticed that someone from the party forgot their phone. And there was no way to tell whose phone this was because the background, the wallpaper, was just a photo of the moon landing, like the moon, like the lander on the moon.
Yeah.
And I just started laughing because I had to go give it to the restaurant, and say, hey, can you put this in the lost and found? So I walk in, I go, I don't know whose this is. I just know that. I don't think that I may not think the moon landing necessarily happened, but, here's this phone. And one of the waiters just walking by, he goes, 3 words. And I was just like, what is this guy going to say to me? He goes, 3 words, Van Allen belt. Didn't happen. And just walks into the kitchen. It was so funny.
Yeah. The other comment I'll make is that they can't find the technology. How did you do something earth-shattering, no pun intended, earth-shattering, and now, the technology and the tapes and everything else is gone?
They lost it all.
Yeah, very convenient.
Yeah.
Don't get me started about the Kennedy assassination.
Yeah. Uh-oh. Yeah.
That's a whole nother show. But that was the biggest scam ever. Suffice it to say.
Yeah.
Let's see what else we have here that's remotely interesting related to medicine. We do want to talk about medicine now and then. A patient has low back pain, wanted to know if PRP may be a good option. That could be, certainly. So for people that have low back pain, when you look at your low back, which are the vertebrae here, from L1 to S1, you have lots of ligaments that go bone to bone and tendons that go muscle to bone that crisscross, become a whole thick representation there. Then you have connective tissue, softer tissues, and skin. A lot's going on in the crisscross or layering there. And of course, you have nerve roots, you have discs that can hit up against nerves. So the perfect test for that is an MRI. We see exactly everything we want to look at. It's like taking slices of the area and then looking at that dead on. You could have measurements, markings, etc. So PRP is taking your blood, spinning it. There are 7 growth factors that come from that. And we could inject those into the area to try to stimulate healing. PRP, however, remember, is only going to last about 3 weeks, 4 weeks maybe, because you're using it up. It's like the sandwich. Did I say sandwich?
Yeah.
I meant to say sandwich. A sandwich that you ate last week, it was gone soon after you had that to eat, and you had to eat again. And you're eating again every day, 3 times a day roughly. So a PRP doesn't last terribly long, but it may be enough to get your body to recognize the area and to create some response. Some people come in for 2 or 3 PRPs. And by the time you're coming in for 3 PRPs or maybe a few more, you're at the level of, the cost of STEM. You're better off doing STEM because that colonizes and creates a longer term result because it's there and stays there for a much longer period of time. So that may be the ideal. But again, the best description of what you have going on is the MRI. A lot of doctors will do an x-ray because they have the machine in their office, and they'll make a comment based on the x-ray, but it's just not enough info. There's no x-ray that shows ligament, tendon, cartilage like the MRI does. So that's why the MRI is the better test. And we make discussion based upon the MRI and a person's range of motion, their physical exam. So it's got to be gathering all of that information together to create the result.
Someone's just asking, can you explain the process with the PRP spinning your blood? How exactly does it work with healing?
So your blood has a lot of great stuff in it. Bone marrow has super, super great stuff in it, including stem cells. We'll put that aside for a moment. So when you spin your blood, there are different size particles that are in your blood. Red blood cells, growth factors, which are what PRP come from. So scientists have perfected the idea of spinning your blood, and the lighter cells kind of stay at the top of that fluid, and the heavier cells migrate to the bottom. And then you're taking out what you want, the growth factors, that are concentrated and then putting them into an injection. With the stem cells, very similar, and we have to use a 4,000 RPM centrifuge. It's required for stem, but I use that for PRP also, whereas most doctors just doing PRP are not going to buy a 4,000 RPM centrifuge. They might even be given the centrifuge for free by the company who's selling them the kits to do it, which is not a super fast centrifuge, so you get less PRP. In doing the PRP with a stem cell centrifuge, we get 8 to 10 cc's of pure PRP, which you'd never get from a slower centrifuge. So with the stem cell, when we extract bone marrow and we spin it, red blood cells are the top layer because they're lighter, plasma, the straw-colored fluid in the middle, at the bottom you have your stem cells, and that's what we take out and use that to inject. So it's a separation process when you use the centrifuge to do that.
Someone said you're like a mad scientist, Doc.
Absolutely. They're just figuring this out. You have to be a little mad, a little funny, a little crazy, and you have to be able to get along with patients.
Someone's asking about the vampire facial with the PRP. Does it actually help your skin?
As I mentioned, the PRP solution is only going to be there for a short period of time, a few weeks. So it's not a bad idea, but it's a little superficial because most doctors are going to either rub that solution on your face, then may roll over it with a device. You know, like landscapers aerate your lawn to put holes in the lawn to put seed in. And there's some cooking utensils that you're rolling and putting holes in to make an effect. Using a derma roller is trying to make tiny little holes in the superficial part of your skin to allow that solution to absorb in. When I've done PRP for patients, for the PRP effect on your face, we take the tiniest of needles, like a 30 gauge, 31 gauge, like an insulin needle, and I'll inject into the skin. So we're putting it into the dermis, not just putting it on top. But think, if you will, of using your own stem cells, which will last far longer, for years. If you take them in 10 syringes with a little tiny needle, and you start to pepper them into your skin, into the layer of your skin, not just superficial, like you might inject Botox. It doesn't go on the top, it goes into your skin to have its effect. If you put stem cells throughout the skin of your face, you're putting new cells that keep coming up and keep coming up and keep coming up. So they're there for a longer time. They're colonizing and creating a much greater result. So there's a big difference.
Someone's asking, I've had cortisone shots in my shoulder that wore off. Is PRP a better long-term solution?
So cortisone shots with a steroid are just making inflammation decrease and you're less aware of the discomfort. Be careful when you do that, because if you start to use that area, that joint or that part of your body, you may not feel it and you could hurt yourself even more because you're not feeling that you're creating more wear and tear in an injured area. In some cases, using the steroid can make the ligaments and tendons worse, or they can tear more because the steroid's there. Just like certain antibiotics have been known to correlate with damage to tendons. So you have to be very careful with that. Stem cells are putting in a colonizing effect to create more and more growth. So that's your best option. PRP lasts about 3 to 4 weeks. Depending upon how much damage you have, PRP may not be enough. And as I say, if you start doing 3 or 4 PRP, you're going to get to the cost of what one stem cell would be. So you're better off doing the stem. So we explain to patients the option once we see what the MRI shows.
How long does it usually... you actually just answered that question. Asking about... People are just wondering the pricing between that and stem cell.
So PRP, I think we charge $850. Most of the orthos charge between $2,500 to $3,000. And, orthos are orthos. They're impeccably trained, and that's what they do all the time, and their fees are higher for everything, for office visits, et cetera, et cetera. So $850 for the PRP. STEM to do one joint is $5,000. So it's not the $30,000 that you hear of in Mexico, Panama, Costa Rica, Europe. You know, when I first started working with this company that I was trained by, as I mentioned before, we negotiated with them to try to get the prices down so it became more affordable. Nowhere in the world is stem cell therapy $5,000 for anything, but we made it so.
And someone's just asking, is PRP effective for women too, or mostly men?
No, of course. It certainly can be. You know, it certainly can be. So if it's a mild problem, then, we'll explain that PRP may be what they need. You know, it depends upon the wear and tear of the area, the severity of the area. I had a friend who was playing, flag, touch, tackle football. People get a little rambunctious with it sometimes, and he tore his quad. And you can see the defect there. And we did it, I think once every 3 weeks we did a PRP into that torn area. It healed pretty well. But remember, your muscle is very vascular, so there's a lot of blood flow there. There's a lot of response there. This just made that repair happen faster. I'm not saying that for ligaments, tendons, cartilage, meniscus, because they don't have a lot of blood flow. That's why stem is the better option there.
All right, what do we got, guys? Make sure I'm not missing anyone.
So, Garden City office, 516-794-0404. We'd love you to call us. Set up your telehealth or your regular consult. Website, drcalapai.com. You can see it.
There we
go. We talk about the vitamin packs. For many years, I've been recommending vitamins for every patient I've ever seen in different offices that I've seen. It becomes super easy now to take the same recommendations specific to you and your blood test, your condition, what we want to create, and make a vitamin pack for you. So you take a pack in the morning and a pack in the evening. You get a box. It has the packs in it. You take the morning pack. You have it with your food for breakfast. The evening pack, go out to dinner if you like. Take the pack with you. Take your vitamins. It's neat and clean. I could change what's in the pack depending upon a repeat blood test. So I don't know what you're going to show me when your blood test is done initially, so we see what's low, make the recommendations, and then whatever's low, we recheck over the course of a month to then see that we've corrected that with my recommendation. If so, great. If not, we'll tweak it again. So the idea is that we want to make sure you have perfect nutrient, vitamin, and mineral levels, and that it's easy for you to do. It's kind of difficult when you're taking nutrients and you're taking them kind of out of the bottle and you got to go to dinner and it just becomes much more involved. And some people will buy 20 different vitamins when you certainly don't need that. We use a multi as sort of the hub of the wheel and we add nutrients on around that. So it's just much more specific and much more accurate and gets you into the perfect range.
So someone's asking, what's a good brand of vitamins to buy? And I would say, go to that website.
Well,
Dr. Calapai.
Yeah, every brand can be different. I tell people to look at labels. For example, let's say you see a multivitamin in a store or online or somewhere. If it's got 30 things in it or 40 things in it, you might say, oh my God, it's got a lot of things in it. There's one company's got 75 things in it. But they may be so low of a dosage for these things, they're putting in lots of stuff, but a tiny, tiny dose that's not really going to change your numbers. So I think it's more important to get your blood test done to see what your levels are. Even if a person calls and wants to do a telehealth consult, I do that. We get someone to come to your home to draw your blood. We go over your blood work, and then we recommend vitamins. That's the perfect way to do it. Otherwise, you're kind of guessing at what to use, and it's not about the brand. It's about what gives you your best vitamin levels. So that's the most important thing I could say specific to vitamins. It's not about the brand. It's about having great levels that we've proven what you're taking is giving you great levels.
Beautifully said. Now you're making me think. I got to throw out my multis. I gotta check
Well,
those.
it's just, yeah, you just got to, I mean, look, millions of people take vitamins. That's great. But also, probably millions of people are low in vitamins because they haven't done the blood test. It's easy to do. Also, we're talking a great deal about RPM, and my phone is pinging left and right because we're working with a couple of big companies. And the RPM mechanism is genius, and I've spoken about this before. So for Medicare patients, they are covering telehealth visits where I or my staff, nurse prac or PA, can speak to the patient, document everything they have, send a lab to get the blood work done, review the blood work a week later with that person. And if they have a variety of chronic medical conditions, document that. We can then send a blood pressure cuff, a glucometer, a watch that looks at your oxygen, your pulse, and tracks many things, excuse me, to track your condition. The idea is that it's safe, it's simple. You check your blood pressure once a day or every other day. If you're diabetic, you're checking your sugars. Maybe we can get the device on you where you'll wear it for 2 weeks or a month to track your sugar all the time. And the tracking thing allows you to have a direct connection with your doctor. It's not going to take 3 months to get a visit with your doctor. And certainly we could do this via phone telehealth visit. But we're able to see if your sugar's too high, too low, blood pressure's high. We could contact you and work it out. And similarly, if you need something beyond that, we could also send the information to your primary care, your cardiologist, whatever doctors you like. So they're gathering this information too. RFK came out saying that he loves the idea of the monitoring because all you're doing is tracking your vitals and just preventing you from getting into a bad place. If it helps us bring your weight down and we talk about low-carb diet for you, we correct your vitamins, these are all great things, the majority of which we can do with you from home. That's why remote patient monitoring is such a great idea. And you're preventing things from going bad and they end up going to that big ER visit, for an $80,000 visit they're going to bill your insurance for. So Medicare loves the idea because we're going to prove, because we have companies now that are looking at this to stratify it and to show data that patients who are on RPM have either better control of their sugar, their cholesterol's coming down, their weight's coming down, blood pressure's coming down, preventing hospital admissions, preventing, huge expense. So we're going to prove and document all this. If you're a Medicare patient, you're interested, certainly give a call to the office, 516-794-0404. You could text or email us at the website. But it's a brilliant way to keep your body healthy and strong. We're hearing from so many organizations now. We're very, very happy about that. We're hearing from doctors who want to do this. So we're going to teach them the mechanism as well. So I think it's going to be a wonderful trend going forward. Case in point, people that have AFib, atrial fibrillation, where their heart's twitching, may not feel it. But we'll know because we'll get a recording of that and then can address it. People's blood pressure is going too high. We can call them and address it. Tell them, oh, you skipped your pill. There's a pill box that's covered, and all these things electronically go to a gateway device that sends us the data and the info, only us. And if you didn't take your pill that morning, then we know that you didn't. We can call and say, hey, you forgot your pill. So it's a great way to keep you on an even scale. Anybody, Frankie?
All good. No questions. People are commenting. They like the idea. They love the idea.
Yeah, it makes so much sense. It's genius, and this wasn't available years ago because the technology wasn't there, but the technology is there now. This cool little watch is rectangular. You press the side button, and the home screen comes up, and you can see your pulse, and you could swipe and look at 15 different categories. I mean, it's genius. But, of course, you would charge it. We need to charge it. But between that, the cuff, the glucometer, the pill box, and there are other devices that are coming down the pike, a scale, that we could really, care for people from their own home. But think of it, this has to happen. It sounds a little futuristic, but no, it's just smart. People can't necessarily get up and get to the doctor. We're also thinking of doing this for non-Medicare patients, but we have to figure out, what those insurance companies, will do. I think Medicare will be the first and best proving ground for this, because once all this information comes out and they see how well it works, most people want to do it.
And that was actually one question was just, is this only for Medicare?
Right now, it's only for Medicare because Medicare endorses it, loves it, has agreed to it, has codes that we have to use that will pay for it. It's once you understand it as well as I do, and I've spoken to billers about the codes and what you can and can't do, and it's a little bit of a mathematic thing. Once you understand it, the guidelines and the rules, and you set those things up. So every patient that comes in that has a need for that, we can set that process up. We check the boxes on their top sheet, which is what we use to communicate within the office. The biller gets the top sheet, gets the codes, sets that up. The company sends them the device. A person can go to your home to show you how to use it. We may even have a bunch of these devices in the office, and we can show people how to use them so we can get them started. So there are a few different ways that this can be accessed or people can get into it. And we like engaging people with this. And I can tell you, I know a lot of people that had the Fitbit and the Oura Ring and all these other things, and will look at that device and say, I only walked 8,000 steps. I got to make my 10,000 steps today. It's great. People want to hit that mark. So great, we want you to hit the 10,000 steps. We want you to be involved in it. We want you to be able to slide back and forth on the different pages of that watch, put your exercise in there. You could even answer text messages on there. It's a smartwatch. It's pretty cool. So we're working closely with the manufacturer, and they're terrific. I had a great hour-long phone conference with them, and they agreed to have weekly discussions as to all of this because they love getting their product out there. And I think it's going to serve people incredibly, incredibly well. It's going to save a huge amount of money. It's going to save a huge amount of aggravation and headaches for patients. And it makes the doctor's connection with patients so easy. Every day I hear people say, I can't get to my doctor for 3 months. And I think some doctors are being bought out by these big companies, and they control the doctor, which is a bad thing. And it may be that these companies are handpicking the patients that the doctor should see, maybe because they have a better, higher-paying insurance, and the other lower-paying insurances are patients are being pushed off to the side. It's my guess.
This is huge, though.
Yeah. It may get to a point where I have 5 or 7 or 10 nurse pracs and PAs facilitating this. Not only do we want to do the initial visit or the initial call and the second visit or call to go over the blood work, but we're going to call periodically, weekly, to be able to see how the patient's doing. So the connection is unbelievable. Where in the world has your doctor ever called you every week just to check up and see how you're doing? I've never heard of it, but now we can do that. It may be a 5, 10-minute, 15-minute conversation just to check up how you're doing. I'm watching your blood pressure. It's much better. You're doing the diet. You're walking 15,000 steps a day. I can see that from your watch. It's genius. This is something that's been needed for so long. And now, patients love it. I mean, who wouldn't love it? The people that we have on it love it because it's sort of like a little bit of homework, a little bit of a game, a little bit of a challenge to them. So it engages them where they were never engaged before. So I love the idea.
Stay tuned. People are asking for the link on where to go. I mean, really just reach out to the office, right?
Yeah, you can just reach out to the office. So 516-794-0404 and the website, drcalapai.com. So important to be able to, and again, we're going to teach other doctors how to do that. So we're working on, a program that can teach other doctors. But that's going to take a little while to do. Most doctors are not great at the math of this sort of thing. So we're trying to see if we can create a scenario where a billing company, we could have them do the billing for the doctor. We may try to find a company that does telehealth calls with nurse pracs and PAs so they can do that for the doctors. So it would be a way to have it all set up and done for the doctor so they can get it done without changing their world or making it difficult for them. So we're working on that.
Let's go. To the moon, but actually to the moon.
Literally.
Unlike back in the day.
I love a good conspiracy.
Who doesn't?
One day we'll do a show on conspiracy theories.
I love that for us. I think
I'll bring some information and we'll just go back and forth.
maybe we'll puff a couple cigars while we're doing
Yeah, we'll get a massive response to that show, I'm sure. You know, the Men in Black might call us and say, hey, no conspiracy.
it. Or you two will just yank us, either one. Well, but we
What
got
was it,
Rumble,
Sector
baby.
7 with, what was it, John Turturro was the actor in those funny movies,
I get that one.
the Transformers movies.
Oh, yes.
Yeah, because they made him strip down. He had Sector 7 underwear on. That was the secret agency that was involved in all that. My God, could you imagine if we knew about all the secrets and the secret agencies, even just in our country, never mind worldwide? Crazy stuff.
Oh, I'm looking forward to this episode. We're going to be doing that one.
Yeah, we might have to go a little bit off script.
Rumble only for that one.
Yeah. Okay, if there are no more calls or questions, then we're pretty good for today. Remember to give us a call or drop us a line if you want to come to a lecture. Call the office, 516-794-0404, drcalapai.com, CALAPAI.com for the website. God bless you all. Have an amazing day. We're back